Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Rida Jawed. She's an emergency medicine resident in Pakistan, and today's Kevin MD article is titled From Burnout to Brilliance, How One Doctor Found Balance. Rida, welcome to the show.
Thank you so much for having me, Dr. Gavin. And it's very exciting to be here.
All right. Well, thank you so much for joining me all the way from Pakistan. And before we get into your article, just briefly share your story and your journey.
Right. So I'm currently working as a resident ESV medicine in the emergency medicine department. And I have worked for like 3 more years as a medical officer before. So I had 6 years in total experience in emergency medicine. So I have been through a lot of different scenarios. Currently, I'm also a mother of two kids. One is 4-year-old and one's 3-year-old. And I'm also very proud wife of a person who's currently at the end of his intervention cardiology fellowship. So lots of things going on my side. As you can imagine, there are a lot of nitty-gritties that has to be done, and there is so much going on. So there's a lot of micromanagement going on. So fortunately for me, all of these things that just came up, they just came up like slowly and gradually. So I learned to kind of cope with them. But over the years, because my roles have expanded as a mother, as a wife, in a residency where you're more academically inclined. So I have learned to adopt these kind of strategies that help me not burn out and perform to the best of my capability.
So tell me a little bit about the emergency department that you practice in. Are you in a large city? Do you work in more of a community setting? So tell us a little bit about your emergency department.
That's it. Okay, so currently I'm working at Aga Khan University Hospital. That is supposed to be the biggest hospital in Pakistan currently, and it's a public setup, but you also have welfare over there because I come from a lower income economic settings country, so that is why there's always that option available. So we see all kind of patients. We see really critical patients who are usually mismanaged from lower economical settings, and they then show up to our private setup. And we also see a very higher class people. So kind of all kind of presentations, and I have seen different groups of people from different socioeconomic class, and usually they have different presentation of diseases, and also they present at different stages. So lots of different things and different presentations.
All right. So I want to talk and explore more about your different roles. Like you said, not only are you an emergency department resident, you're also a mother to two young children. And you talk more about that in your Kevin MD article, From Burnout to Brilliance, How One Doctor Found Balance. Now tell us, how did your article come together?
All right. So actually, since I've been practicing in emergency medicine for the past 6 years, I think I have gotten a gist of how it how you're supposed to perform as an emergency medicine physician, because there's this constant pressure and adrenaline rush that you go through when working in the emergency departments. So it gets a bit overwhelming at times, and it can also make you feel like you are obliged to perform in a certain way. And at times, like I mentioned in my article, there are some few things that I've learned over the years that help me cope in that stressful environment. So the article actually just came about and set of rules that I practice that I've made for my own self that I do just to like tackle all the chaos that is emergency medicine.
All right. Well, why don't we go into some of these rules? Tell us more about those.
Okay, so rule number one, it always starts with yourself. So the number one rule is you have to prioritize yourself first. So I know that in emergency, there are all of these critical patients who are just coming in and you are so full of this adrenaline rush and you just want to help everybody. There is a lot of times we just forget to eat ourselves, drink water, go to the bathroom. And I have done that. I have done that so many times. Like at the end of a 12-hour shift, I just recall that I did not even have one glass of water. I had nothing to eat. Sometimes there would be food in our room, but it would just go cold and nobody's there to eat it. None of the doctors show up. And at times our faculty is actually coming up there and asking us to go in the room and just eat something for God's sake. So it can get very overwhelming because because in an emergency position, we have this strange drive to just kind of help everybody and just tag everything just walking the door. It gets very, very difficult to control that urge and just, tell yourself to just take a moment, just pause, think about yourself a little bit. and, just relax and just, shift gears to a more peaceful situation and care about yourself a little bit more. So I think over the time, because initially it used to work out just fine. I mean, you used to have all these people who used to motivate you because everybody was working, nobody was taking breaks. So it just seemed like what it should be doing is working. And then this culture that we have that rewards this workaholism all the time, that the person who's working extra is the person who's the better one. And so taking breaks is kind of frowned upon at times. And if somebody takes too long of breaks, then that is also frowned upon. So over time, it gets kind of tiring
Hmm.
and you end up realizing that you have exhausted yourself, especially by the end of a 12-hour shift and you have back-to-back shifts. Then it gets pretty tiring pretty quickly. So if you're not taking those breaks, if you're not prioritizing yourself, if you're not going to the bathroom, you're not taking that water intake, you're not making sure you're eating properly, if you're not making sure that you have healthy relationships with your colleagues, your department, you're making sure calling home at times just to make sure that everything's all right, it's going to take a toll on you eventually. So it's very, very, very important to prioritize yourself first. And I think that's rule number one that I've learned over the years. As a mother too, as a doctor as well, I know you feel guilty for not putting other people's first, but you have to because you cannot keep pouring from empty cup.
Now,
That's
how long did it take you to realize that rule? Because, like you said, you're a mother, you're a wife, you're learning emergency medicine, you're being pulled apart in so many directions. How long did it take you to realize that you need to take care of yourself first?
I think in every role, I have to realize it over and over again. Because first I was working as a medical officer, so not much was expected of me. I was just used to see the patients. So then I had to realize this that, I come first. I should focus more on myself. So that was that. Then I become a mother. And then this was a whole guilty thing all over again that, I have to keep the kids first and I have to sacrifice my sleep. I have to sacrifice my diet for them.
Hmm.
So then I had to, again, learn this lesson again. And then when I shifted to residency and then it became more academically inclined, so then that also started taking priority. I would not eat. I would not sleep. I would miss, it's very obvious that people put all-nighters when they have exams. So that is your academics taking over your self-priority and your self-care. So I have to relearn this same rule over and over again in different stages of my life. I'm still learning.
All right. What's rule number two?
So rule number two is I would call it begin with a game plan. So every time that and this is something that I learned after becoming a mother. Before becoming a mother, I was just out answering for myself. So I used to do whatever I wanted to do. Nobody was there to question me. And it was just me, 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 right? But when I became a mother, I started realizing that you have to take care of these little kids. And so you have to plan ahead. You
Hmm.
have to plan like what things I want to take, their breakfast, their meals, if I want to go somewhere outside with them, so what I'm going to take. So I kind of brought that thing inside my own job after I became a mother. This is something that motherhood taught me is to plan ahead. So the way that I plan ahead usually is because I'm usually short of time now because I have so many rules going on. I try to iron my clothes and just kind of set them apart, like on Sundays or the weekends, and whenever I get a day off. So I would have it planned the entire day. And that is why I would not have that anxiety like every day, like what I'm supposed to wear when I open the cupboard and I'm staring at it for a while. So that anxiety is gone. Secondly, I have a designated bag that has my stethoscope, that have my pen, that have all the stationery that I require on a daily day-to-day basis. It has a separate wallet with the money. So I know that every time or any time that I get an emergency call and I have to just go, I'll just pick up the bag and everything is in there. So that's a lot of anxiety release. When it comes to my shifts, when I'm going in my transit route, so what I do is we actually have a hospital application on our mobile, which helps me see through the list of the patients and I can see their investigations and the lab reports. So I usually go through that on my way. So that usually gives me a good idea about what the diagnosis of the patient is, where the patient's going. It also helps me make a priority list of the patient, like which one I'm going to see first and which one's more critical. So it gives me a good zone to and a comfortable position to start my shift in because I know with the patients I'm going to see beforehand, in contrast to those people who just came in and just getting it over from the patient, from the previous doctor. Sorry. Um, so that preparation in the transit route helps me a lot. At times, I also like to go through the updates, literature updates that the topics the patient are usually going to present with. So that's something also I do on the transit route. So that kind of eases it up my entrance into the shift, and that helps me get more comfortable in my surroundings much quicker.
So it sounds like preparation is a key tool that you use to fight all the commitments that you have, all the anxiety that is the potential from all the different ways that you're being pulled apart, right?
Yes, that's true. That's a very good way to say it.
All right. So you have rule number 3 I see here, communicate effectively. Tell us how do you use that rule on a daily basis?
All right. I would like to personally say that I put a lot of effort in communicating with the people around me. That is probably because I believe that communication is a prime skill that everybody needs to learn. If you're walking in your hospital, and I usually am friends with all of my staff, so I wave to them, I say hello, how are you? Put a compliment here and there. That looks nice. The scrub you're wearing, it's nice color. So that just kind of eases up the tension among everybody. Then I take the over of the patients, and then I go visit the patients. So I always kind of try to put a personal touch in,
Mhm.
like meet the family, somebody they're close to, just, put a joke in here and there. And I think my juniors would really go for this, that I'm a fun senior to work with
Mhm.
because I'm always joking around during the shift. So that kind of eases up the whole chaos and the tension. So whatever's going on in the medicine department, I just tell my juniors, just relax. We work in our own pace. We work in our own comfort zone. So no, nobody's going to rush anything. We're just going to take it slow, one step at a time. So I communicate with all of my staff members, and I'm in good terms with them. And I think it's very, very important because ER is a teamwork, and you're supposed to be a team player. You cannot work in ER without having a good team support. So you really need those people to back you up. There have been countless times that my juniors have told me they have not been scared to communicate with me. So they have at times told me that I think this patient has something else. Or my staff comes and tells me, who have been with the patient longer, that I think that this patient is also showing these symptoms. So do you really want to go with that? So that really does help me, change my route or rectify it, or, alter whatever I'm doing. And that helps the patient in the end. So I think that having a team who has confidence in you and is not scared of you, and who can communicate with you directly because you have maintained that kind of relationship with them, a level of friendship with them, I would say even it's very, very important. And then having that kind of relationship with your patients as well, in which they can really ask you things and really ask their queries. Because in ER, the first rule that we are taught is to ask the patient, what brought you here today?
Mhm.
So if patient has all these kind of problems, but they're just there because they want to feel reassured for something. And if you have not reassured them for that, then the patient does not feel satisfied whatsoever. So I think the main important thing is to really communicate with the patient, like really ask them, what do you want? What do you want out of this visit? Why have you come to my hospital? How can I help you? And I think having that kind of clear communication about their goals, that is going to help you like provide better care to them, and increase their satisfaction with you. So I think communication is the major key overall when it comes to your team dynamics with your patients. I think that's rule number one of teamwork: good communication.
Now, physicians in the United States, and I'm sure in Pakistan too, are so busy, right? You have so many patients to see and so many things to keep track of. And sometimes that time that you don't have interferes with the communication that you said was so important. So, how do you manage to slow down that time, give yourself time to communicate both with your team and patients when you just have so many things that's pushing you on to the next thing, and sometimes physicians may feel so rushed. How do you take a moment, take a breath, and really ensure that strong communication?
All right. So there are a couple of things that I have learned, and there are actually some researches that I have read. So one of the few researchers say that if you sit down when you're with the patient, then they're feeling like the 5 minutes that you usually spend. Like if you spend 15 minutes standing up and talking to them, But versus whether you sit down 5 minutes with them, they feel that the time has passed a little bit more slowly. Also, when you have a bit of physical gestures with the patient, like you touch the patient and you come on their eye level and you talk to them and you do something personal. I think personally, how I like to communicate is I like to go for something personal that that really opens them up and then feel more connected to me. So whatever I'm going for, I think I reach that sooner, in comparison to if I just keep talking to them and then never really get to the point. But if I introduce something personal, if I sometimes I just say, yeah, okay, I also do that. Or yes, I know how you feel. That must feel very bad or whatever. And I understand. I hope that I can get to you something for the pain. And just let me know if this does not help you with the pain. I'm going to give you something stronger. So just, kind of talking to them in a personal way that kind of shortens the time that I have to take with the patient and kind of helps them open up a bit more. Also, I think that I have to keep reminding myself too to just calm down and just not rush into it because whoever's coming there have the worst day of their life going on, probably. So I really need to be a sense of comfort to them, a person of comfort to them, and to help them kind of, process whatever they're going through. So I have to keep reminding myself to not rush it. And at times it's not really possible, of course, because there are so many patients coming in. So I just kind of like try to delegate the task to somebody else. Like, okay, fine, you start with that patient. I'm going to come finish with this person. So then I'm going to come back to you. So that kind of also reduces the time that I need to interact with the patient somewhat.
I think that last point you made was very powerful in that no matter how busy you are and no matter how many patients you've seen that day, for that patient, it's often the worst day of their lives, the worst time of their lives, especially in the emergency department. Now, you have three other rules here. And if you want to read all the rules, let's go to the link of your article, then put that in the show notes. But take one of the last few rules and talk about that.
So the last rule that I have, this is very, very important, and I think that's perfect ending to the article, is that you have to reflect on what you have been through the shift. So I think self-reflection is very, very, very important for your growth. And at the end of the shift, I usually like to, verbally tell myself what I did good, what I could have done better. And I also try to jot it down.
Mhm.
At times I get feedback from other people. At times, my patient outcomes tell me what the results were and how it was. So I do take my time to just, like really reflect on that and really see the areas where I can improve. Because if you're not reflecting, it's like starting from point zero every day. And that's not going to benefit you or your patient. So self-reflection is crucial to growing and improving. And at the end of the day, obviously, you just need a time to yourself. That's also like a self-care part, your self-reflection. And you really need to like take a pause and just reflect over it. And, journal if you want to. I journal at times. So that's very important. So you don't repeat the same mistakes again and improve on the things that you were already good at. So I think a person over time, they become a really good judge of their own character. They know what they're doing right and they're doing right. Like if you really go inside yourself, you will hear that voice. You'll know what you did right and you will know what you did wrong. Because at times when you do something wrong, that voice corrects you itself like immediately, like, oops, that was a bit
Mhm.
harsh or that was not right. So and over time, you become a better judge of your own character by seeing other people, by seeing yourself. So you realize your own strengths, your own weaknesses, the areas that you need to work on. So I think self-reflection is super crucial to having a good shift and making sure that you're improving over time.
We're talking to Rida Jawed. She's an emergency medicine resident in Pakistan, and her Kevin MD article is titled From Burnout to Brilliance How One Doctor Found Balance. Rita, tell us some of your take home messages that you want to leave with the Kevin MD audience.
All right. So my take home messages are these 5 points that I have. So number one is that you have to prioritize yourself. Number two is that you have to start with a game plan in your shift. Number three is you have to really communicate effectively with your team members, with the patients. That's the key goal to maintaining good relationships with everybody. You have to keep learning. You have to keep growing. You have to teach your juniors. You have to learn from the seniors. It's a give and take process. You have to take breaks. You have to take care of yourself. You have to delegate the task. Don't try to be a hero. You're just a human being. So remember your humanity and work with it. And at the end, just make sure you reflect and you take out time to know what you did right and what you did wrong. So you can continue to improve and be a really good doctor.
Rita, thank you so much for sharing your time and insight. And thanks again for coming on the show.
Thank you so much, Dr. Cameron. Thank you so much for having me.